a woman that came with her child. She just came into the, through the reception and all that, into emergency. So she was crying and all of that. The child had seizures, febrile seizures. So we quickly, rushed in. There was prompt, attention to the child, and we had to put the child on left lateral position. Give some diazepam to help the seizure, abort the seizure, and also give some paracetamol and all of that. And then we had to educate on how to manage such a situation if it happens again. She was crying and all that, but we had to reassure her that the child was going to be fine and all that. We did some tests, and then we were able to manage. Again, there were financial constraints, right? But we're glad about the fact that we're able to at least offer some care at that time. I had to go personally, I had to give some money, for she get money for gas and stuff like that. Sometimes we get those kind of things a lot. Sometimes patients come in not necessarily because they are sick, but they're just support. You need some financial support and all of that. Yes, part of the reasons for the encounter. That was also a memorable time for me. And then finally, there was one. This was the patient that had the capacity to pay, but because of the fact that we are offering wellness checks, right? If we didn't have that, we didn't have an ECG to get these wellness checks done. He came in, and we were able to run an ECG for him. We did other tests and all of that, and we were able to discover that he had some issues in his heart and all of that. His blood pressure was not well controlled. So we were able to talk to him and counsel him further because of the tests that we did for him and all of that. And he was better, educated that, okay, I have this issue, and then I can be able to manage it appropriately and all that. If we didn't do those tests, he would never have known the importance of having those wellness checks. So those were memorable times for me.